Hello and welcome, IGNOU aspirants! Look, if you've been struggling with how to really structure your exam answers to get the best marks, you've come to the right place. Today, we are going to build from the ground up the perfect, high-scoring answer for a super important topic, health services.
Okay, so let's just dive right in. The secret to a great answer isn't just about knowing the information, it's about how you present it. You need a clear structure that hits every point the examiner is looking for. So we're going to break this whole topic down into 4 key questions. All right, first things first, you've got to start with a rock-solid definition. But if you really want to impress, you can't stop there. You have to outline the core characteristics of an effective health service, the ones laid out by the World Health Organization.
Now, here's a little trick for you, something to help you remember all 8 of these points when you're under pressure in the exam hall. It's a mnemonic: quack, pace, ace. I know, it sounds a little funny, but trust me, it really works. It stands for comprehensiveness, quality, accessibility, coverage, continuity, person-centeredness, accountability and efficiency, and finally coordination. This is your ticket to making sure you don't miss a single point.
So let's just quickly break down that first one, comprehensiveness. When you write about this, you have to, and I mean have to, mention the 3 pillars. Preventive care, which is all about stopping illness. Curative care, for when you need treatment. And rehabilitative care, to help you recover. Think about it. A national health mission might have vaccination drives, that's preventive. Treatment at a local clinic, that's curative. And physiotherapy after an accident, well, that's rehabilitative. It's the whole journey.
Okay, now for a point that really separates the top-tier answers from the merely average ones. So many students use healthcare and medical care like they're the exact same thing. Well, they're not. Let's make sure you can explain this crucial difference with confidence.
And here's the breakdown. See, healthcare is the big picture. It's about staying healthy in the first place. Your lifestyle, your diet, exercise, it starts the day you're born. Medical care, on the other hand, that's what you need when you actually get sick. It's the treatment you get from doctors and hospitals. So one is proactive, the other is reactive. Simple as that.
And inside that big idea of healthcare, there are these 3 levels of prevention. Primary is about stopping a disease before it even gets a chance to start. Think of India's huge pulse polio immunization program. Secondary is about catching it early, say through a cancer screening. And tertiary is about managing the illness and recovering after the fact, like physiotherapy after a big surgery.
So here's a really crucial part of your answer. It's not enough to just say health services are complex. You have to explain why. So let's break down the 5 key factors that make it all so complicated. This is where you can really show off your deep understanding of the topic. First off, it's not a solo act. Not at all. A single patient's treatment involves a whole team of specialists working together. Just think about it for a second. A doctor makes the diagnosis, a radiologist takes the scans, a surgeon performs the operation, a nurse provides the care, and a pharmacist gives out the medicine. It's this incredibly coordinated, complex dance.
Second, you have what economists call the multi-product nature of hospitals. A hospital isn't like a shop that sells just one thing. Nope. It provides a whole bundle of interconnected services. You've got diagnostics, surgery, aftercare, the whole shebang. You can't really have one without the other, and the cost of one service is always going to affect the others.
Third, there's the relentless, nonstop demand. A heart attack or a road accident doesn't care if it's 9 to 5 on a weekday. Health emergencies can happen anytime. So hospitals and their staff have to be ready to go 24 hours a day, 7 days a week, and that adds a massive layer of operational complexity. Fourth, and this one is absolutely critical, is the life-or-death risk involved. A tiny mistake in one part of the system can have devastating, even fatal consequences. Because the stakes are so high, it means every single part of the system, from the lab technician to the top surgeon, has to be perfectly reliable and seamlessly connected.
And finally, think about this. How do you even measure quality? I mean, you can tell if a new phone is good or bad pretty easily, right? But how do you judge the quality of a doctor's diagnosis? It's super subjective. It's based on complex information, and it makes it incredibly difficult to standardize and measure.
Okay, let's move on to the final piece of our perfect answer, the market structure. And in the Indian context, this is all about understanding the dynamic and the huge differences between public health systems, like those under Ayushman Bharat, and the big private hospital chains. Here's a side-by-side comparison for you. The public system's main goal is service, which is why it's free or very cheap. Now, there are 2 economic principles you should definitely mention here. First is non-rivalry.
Think of it like this. If you're in a crowded government hospital waiting room, you being there doesn't stop someone else from also coming in to wait. The second is non-excludability, which just means it's pretty much impossible to stop anyone from using the service. The private system, well, it's the total opposite. It's driven by profit and your ability to pay.
Now, this difference in their main objective leads to a massive gap in patient load. Because the public system is open to everyone, it often gets completely overburdened, just like this chart shows. This is a key feature of the Indian health market, and you absolutely must mention it in your answer.
And when you're talking about the market for doctors, here is the exact jargon you need to use. It's a monopolistically competitive market. Now, what does that mean? Well, it's competitive because you have lots of doctors to choose from. And it's monopolistic because each doctor is kind of unique in their reputation, their specialization, their quality of service. It gives them a sort of mini monopoly over their own personal brand of care.
All right, deep breath. We have covered a lot of ground. If you're going to take a screenshot of anything from this whole explainer, this is the one. These are the golden keywords and concepts that are going to get you the highest marks. Let's do a quick final lightning round revision.
So the most important thing is to weave these exact terms into your paragraphs. When you talk about comprehensiveness, list preventive, curative, and rehabilitative care. Clearly separate healthcare from medical care. And for the market, you absolutely have to use the terms non-rivalry, non-excludability, and monopolistically competitive. Using this language shows the examiner that you've truly mastered the material.
And there you have it, a complete blueprint for a top-scoring answer on health services. If you follow this structure and use these keywords, you'll be in a great position. Let us know what IGNOU topic you want us to tackle next for you. All the very best for your exams.